just now discussed, COVID-19 pandemic has changed all our lives and has given us a new meaning into life. In fact, it has affected everyone, everywhere in the world. Our country had our own share of problems. The healthcare system in our country did take the brunt of the viral pandemic. The pandemic brought out many weaknesses in our health system, mainly the poor infrastructure and the inadequate availability of essentials and inefficient supply chains. Of course, at the height of the pandemic, we did not have enough hospital beds, and even oxygen supply was in demand. But one of the things that brought out was the strength of our health system and the resilience of the system in handling the pandemic. The main strength that we exhibited was our healthcare manpower. Our doctors, nurses, and paramedical staff rose to the occasion. They worked very hard in extremely difficult and challenging conditions and saved many lives. In fact, many even sacrificed their lives to save the life of the people. An important casualty during this pandemic has been the non-COVID medical care. Large number of patients with chronic diseases such as diabetes, hypertension, heart disease, etc., who need regular medical care were and are suffering even today, sitting in their homes due to this pandemic for more than a year. These diseases, especially diabetes, which is a typical example, is also age-related and increases the risk of complications and adverse undesirable outcome in COVID infection. It is estimated that about 80% of deaths during COVID infections, especially in our country, were among people with comorbidities such as diabetes, hypertension, and heart disease. In our own study, which was done in Chennai, we had collected data from about 5 hospitals in Chennai. We all collected 1,000 patients. This is a study done last year during the pandemic among patients hospitalized for COVID infection in Chennai. And we found that the mortality or fatality was 2-fold higher in diabetes compared to those without diabetes. We also found almost all the complications during the COVID infection was significantly higher among diabetic patients compared to non-diabetic patients. One of the important things which came up was kidney failure was almost 6 times higher in diabetes compared to people without diabetes. However, another factor which came up was that diabetes was not only a risk factor, but also needed aggressive therapy during COVID infection, and about which Dr. Nandita will be talking about. We also found the level of control of diabetes was directly correlated with the adverse outcomes of COVID infections. Therefore, keeping diabetes under good control during the pandemic is of utmost importance. We all know that the prevalence of diabetes is high in our population, especially compared to the Western population. And we also found that about 50% of the people with diabetes do not know that they have diabetes. On top of this, we also found a new emergence of a new form of diabetes due to COVID infections. And Dr. Nandita will be talking about diabetes and COVID in detail. Of course, the drug therapy for diabetes need to be modified during the COVID infections, during hospitalization, and even after the COVID infection is completely resolved. Today, we find that many suffer from post-COVID sequel or syndrome after recovering from COVID. We are still in a learning stage of this aspect of this illness. This can range from simple psychological problems and depression to extreme physical illness involving even neurological conditions. At the same time, we also found diabetes goes very much out of control during the post-COVID period, and definitely they need modification and change of diabetes drugs or more uptitration and aggressive therapy during the post-COVID times. And as I said, Dr. Nandita will be elaborating on this aspect. A very common question that is frequently asked now is regarding vaccination, whether people with diabetes can go for vaccinations. The answer is definitely yes. In fact, it is recommended that you take the vaccination as early as possible if you're a diabetic and if you have any associated conditions such as high blood pressure, a heart disease, you already had a bypass surgery, etc., because these conditions make you or give you higher risk of getting complications during COVID infections. Now, generally speaking, diabetes is a chronic disorder, and most of the patients are actually asymptomatic. And one will feel healthy even if the blood sugar is not under control. A very deceptive sense of well-being. But it is important to keep sugar under control along with optimized control of your blood pressure, cholesterol, and body weight as well. This makes it mandatory to have regular medical checkup at periodical intervals and consultation with your doctor. Once in a year, we should have a comprehensive check, including heart, eyes, nerves, etc., in order to prevent long-term complications of diabetes. Even in the non-COVID times or pre-COVID times, elderly people, especially people with diabetes, I'm talking about diabetes because diabetes is age-related. Many elderly people find it difficult to go for regular visits due to many problems of visiting a hospital and the time that you have to spend for going to the hospital and the time that you spend in the hospital. And many of them, being elderly, have to depend on their sons or daughters or somebody young in the family to accompany them to the hospital. It is often they find it difficult and they will not have time because they are all working. These difficulties make them drop out of the routine care. And this is a very common thing that we have been seeing for the last 2 decades. This makes them vulnerable to complications, and often they end up in medical emergencies with acute medical events. The COVID situation presently has worsened this particular situation. The scenario is much more critical. The fear of exposure to COVID and the lockdown rules have made it almost impossible to go for routine checkup. Understandably, the priorities have changed both for the families of the patients as well as the medical side itself. Thousands of people with diabetes are not able to seek routine diabetes check as the hospitals and doctors are busy with the pandemic. Nobody wants to get exposed to the hospital environment today, and even a long wait or a few hours of wait in the hospital to see expert doctor is absolutely not desirable. Therefore, we have now come out with a solution. All of us are already familiar with the use of the internet for buying provisions and ordering delivery of food at home and even getting a service such as a haircut. Our new plan is to deliver a total diabetes care at your doorstep. We have developed a unique medical mobile app called Diahome, and you can see that logo behind me in the virtual background. This app can be downloaded in your mobile phone like any other app usually you do. Once you download the app and register, we will arrange the blood check and video consultation with expert diabetes specialist sitting in the comfort of your home anywhere in India at a very affordable price. Dr. Arun will give full details of this diabetes telemedicine program, and the details can be discussed. We believe that this app will help lakhs of people with diabetes to receive expert diabetes care at home without getting out of their homes at all. And Dr. Arun will be giving an elaborate description of this new medical app for diabetes called Diahome. Thank you.